more comfort.
Well, Dana, when did you find out? Just at birth?
Just at birth, and actually he was diagnosed, I think the first day or two with Treacher's, actually.
With Treacher Collins?
Right.
Yes. Which was a mistaken diagnosis.
Correct. And we had all of the different specialists come in and out, and unfortunately half of that week was not really rememberable.
Mm-hmm.
Bit in shock, and I think the family was doing most of the listening to the doctors than I was at that point. But then I think within 2 or 3 days they did say he had Goldenhar, but it wasn't even really discussed as a syndrome. It was discussed that, well, here are all the issues that we have, and we have to, tackle one thing at a time. And for us at that point, it was just really making sure that he could breathe and eat. Right.
So he was in what we call the NICU, the Neonatal Intensive Care Unit.
Correct.
And was he struggling to breathe?
At first, actually, no. The issues were feeding. We tried a Haberman bottle, and he didn't do well with that at all. He would, his oxygen levels would plummet, and he would gag, and he didn't like that very much. I'm sure his soft cleft palate wasn't helping. Right. So the first month was just really focusing on feeding, and then finally we got the G-tube in, which helped drastically. Right.
Dana, what I'm trying to remember now is how we actually first then made the break, got him out of there. I mean, I think we voted him the biggest baby in the NICU at NYU.
I know, and we were taking bets also at that hospital on at what point will Kiran come home? Right. Is he going to be the oldest baby? It actually was, I want to say, the week of his 6-month birthday, because he was hitting major milestones developmentally. The family was concerned, especially Sharon and I, about, well, how is he going to learn how to walk and crawl?
Right.
6 months old.
In the NICU.
Yeah, so it was becoming more challenging, and especially his hearing, because at that point in time he didn't have
he didn't have the hearing aid. Right.
Correct. Yeah. So finally, Sharon and I were like, you know what? We're just going to send an email to you, Pat, and attach a picture. And this one thing for everyone who's
when I saw that picture, and I thought, okay, time to come over. He's huge.
And that's one big plug I want to say for your team is how incredibly coordinated everyone is. How as soon as we got in touch with you, how quickly we were able to get over, evaluated, spoke with Dr. Warren, who, as an aside, is our hero. We absolutely love your team.
Well, I'd love to hear that.
Yeah.
Thank you for saying that to our boss. We love that.
Oh, well, yes, Dr. McCarthy, you have trained your team very, very well.
Awesome.
Yes, and I'll echo one of the earlier callers as far as, once we got to your team, we just had our faith and our trust in you. And ever since then, everything has been falling into place beautifully.
Dana, how did you hear about us?
Actually, my in-laws are very familiar with NYU and have been pushing this from day one. My husband also was, once we knew we had Goldenhar in the family now, he started doing research and the Craniofacial Center came up. So we're very blessed and fortunate to live in New Jersey and so close to your team.
And how long were you here at the NYU Langone Medical Center?
When we first got there, 5 weeks. And he had his first jaw surgery at that point. And then toward the end of his stay, he had the Nissen fundoplication, and the G-tube was placed in another area.
Right, yeah, there were some issues about the feeding tube and making sure we got him home with that in good shape.
Right.
No, he definitely had a long NICU life, and I'll tell you that the NICU nurses just absolutely loved taking care of him, and you guys, you were very, very, you were just really loved.
So for the NICU nurses, they thought they had an adult.
That's right.
And my son loves to flirt with nurses.
Oh, he did.
It's even worse, but that's the one thing I have to say. I mean, overall, just the care at NYU has been phenomenal, but just, you expect that, yes, when you go to a hospital and you're dealing with experts, you're going to get the best medical care, but the bonus is having that bedside manner, having people who truly do care about you and your family, and as you're saying, the extended family, because it is something that, as a unit, we're all dealing with. It was, like I said, an incredible shock when you have nothing to forewarn you, and here you are so happy, and we have this beautiful baby, and then, you're trying to put all these pieces together, and here our NYU family is guiding us through that, and it's just wonderful to have that support. I can't echo that enough.
But you know, Dana, I think it would be interesting for our listeners to hear the different specialties or team members that you've dealt with all along.
Oh, okay.
Okay.
Yeah, our new best friends?
Yes, because
I like to say.
Well, it all starts with an obstetrician, right? And then a pediatrician.
Right.
And then you probably had a pediatric pulmonologist or a breathing expert.
Correct.
And then a pediatric airway expert or otolaryngologist.
Correct.
We got to add the plastic surgeon.
Got to add the plastic surgeon in there.
That's right.
And most important of all, the nurse practitioner.
I know, we love you, Pat.
Oh, I love you guys too.
You have helped us so much. Yeah,
Well,
we actually, I think
she's
the
the
last
big
time that
boss.
I counted was 9 specialists.
Oh, I think you had more. How about social work
Social work,
and speech, hearing?
Yep, speech and hearing, PT, OT.
Oh, and you also had a pediatric surgeon, I think, for the fundoplication.
Right.
Yes.
Right.
So you're in double digits, I think.
Yeah, and then we have an ocularist as well.
Oh, that's right.
Yep. Major and Googleman have been fantastic.
Right. So
Yeah.
he's had, since he came to us, he had the jaw surgery, and then he had 2 other surgeries, correct?
Yeah, actually 4 surgeries total now with you guys. We had our last one for his palate repair was what we call our lucky number 7.
There you go.
Yeah. So he's had the jaw, the tongue suspension, the soft cleft palate, and then he ripped out his G-tube. That was a fun, unexpected surgery. So that marks 4, and then we had 3 at the hospital where he was born.
So how old, Dana, is Kiran now?
19 months.
19 months. So you've had an action-packed year and a half, haven't you?
Yeah, it's been fun.
And how do you keep your good cheer and equanimity through all of this? What advice would you give? Because you come through over the telephone as optimistic and upbeat.
I mean, if I could just chime in for just a minute there, because I think most of everything...
Do you have permission?
Wow, I'm on radio, so I'll say no comment.
But I think, I think the biggest thing is I think everybody knows that you guys are phenomenal as far as what you do with medicine. But I think the biggest thing is I think it's the communication, I think, that makes... I mean, not most of the news that comes through from one side is good news, and it's just about how you communicate that.
Right.
And I think, Dr. Vaughn, Pat, and, everybody has been phenomenal in, keeping expectations at a acceptable level.
Right.
And then
being realistic.
Come up, being realistic, pretty much. And, and pretty much.
You know what I think about you, and I've said this all the way through, and I say this to Dana, is your sense of humor. I think that has kept you guys sane.
Yes, and unfortunately, I think we have a little bit of a sick humor, but it does work.
A little bit, but it works. It works. I think other parents could take it from you.
I think humor is something that everyone needs in life.
Yeah, I mean, it's something that you really can't control. There are so many things in the world that you can't control. So I would rather concentrate on that and leave the stuff that I can't control, to leave it to you guys.
Exactly.
To do what you do best.
I don't know if you were listening earlier, but of course Kiran is now growing up, and he's going to become part of this communication. And we were talking earlier about 7 or 8 year olds, how they start resisting treatment recommendations, so that now, of course, the communication has been fundamentally just with the 2 parents. But
right.
You're going to find it's going to change as the members of the team are going to have to work very hard communicating with Kiran.
Yeah, with him, definitely.
So,
I mean, how do you best communicate something like that? Because, I mean, if it's something like, if it's something I had that I lost that I want to get back, I'm going to, whatever I had, I'm always going to miss. Versus somebody like Kiran or any other child in that situation, they really have not experienced what they're missing, so they're not missing it.
So you mean for them, this is sort of normalcy. This is their normal.
Exactly. So they're starting off, I mean, a negative, quote unquote, negative normalcy, which is not normal to other people. So I'm trying to tell him, hey, you need to get your ears worked on when, if he has no, I mean, real negative experience, socially, he would be like, why do I need that?
Right, and that will happen. Although, on the other hand, I have so many kids who will come to their parents and say, okay, I want to have my ears made now.
Yeah.
And they come to you about it. So I think it has to do with them developmentally and dealing with them at different stages in terms of what questions they ask you, what do they understand, what can they understand developmentally. So I think it's sort of watching them evolve, like Dr. McCarthy talked about evolving.
To a grandfather who was calling earlier, I said it evolves, because you will find talking to a 6-year-old Kiran may be very different than talking to an 8-year-old Kiran. It's like parenting in general. You have to stay with your child every day. You have to make sure you're communicating every day. And I think for all of us on the team, communication with the patient is so important. And we say over and over again to our patients, listen, we're going to have no secrets from you. Everything we tell your parents, we're going to tell you. So just as it is important for you to have the trust of your child, the same is true for all of us on the team. We want children to trust us. And really, the team is extended, isn't it? The team is not just us at NYU. It's also the parents and the child, and we form this team together. And I think that's what we try to do with the child, is to get the child onto the team.
And I think, too, that both of you will start working more with other members of the team now, whereas in the beginning, a lot of it was with me and with Dr. Warren and getting those surgeries done. And now you're going to be focusing more in on his speech and his hearing, and then you will, I'm sure, start to utilize and get advice from our psychosocial team in terms of social work and psychology, and helping you as he is changing developmentally, giving you advice about how to deal with some of these things. Because many times I get a call from a parent, and I will say, okay, you need to talk to Sally or you need to talk to Aileen about this. They can really help you.
Yeah, and we're very fortunate. My father, he's now retired, but he's a school psychologist, a child school psychologist, excuse me. So, I mean, he's been wonderful from day one as well. And I think all of our family has, and that's made the world of difference. And it is, to go back to what Russell was saying earlier, to be blessed with so many different people who rally behind you, and our family has consistently been there for us. Luckily, Sharon's parents are right around the corner, and his brother, and then my family is remote in Texas and Florida, but I never felt that they were so far away to where we couldn't pick up the phone. And my parents actually have been up here so many times, it's almost like they're still living in New Jersey.
Right.
So we thank our family for that as well. And just to show, like, for Kiran right now, because he is so delayed with his expressive language, we've decided to learn more with sign language until he's ready to speak